Hello, and welcome to Keep Middlesex Moving's Mobility Matters podcast. I'm Cristina Fowler, and I'm joined today by my fellow co-host, Chris Gonda.
Hi, everyone. Hope you're doing well where you are.
On today's episode, we have Kate O'Connor from the Brain Injury Alliance. Thank you for joining us, Kate.
Thank you for having me.
So before we get into this episode, like so many women in the workforce today, I know that you wear quite a few hats. Can you give our listeners a little background about your path to BIA and J and your story and how you got involved?
Yeah, so my path to here really came from my personal story and kind of what happened to my family. I lost my best friend officially in 2014 as a result of someone else's action and unsafe streets. My brother Jimmy was 25 at the time. He managed a bar called Public House in Manhattan, and he lived in Astoria, Queens, and he would take cabs home. And as he was getting out of one cab, a cab coming in the same direction hit him at about 50 miles an hour. So as you can imagine, getting that phone call, changed my life forever. My brother didn't die right away. He suffered a severe traumatic brain injury for the next 2 years in multiple rehab centers before passing away at the age of 27. I was studying public health at the time as an undergraduate student. So as a public health student does, I started to ask the question of why did this happen? Why was he hit there? Was there a reason why he was hit? Was this his fault? And I quickly found that where he was hit was an area where a lot of people were getting hit on 21st Street in Queens. And I found this through a quick Google search. There had been a lot of people who were already protesting for safe streets. And now, mind you, prior to this happening to me, I didn't even know that safe streets were a thing. And I was studying public health. I'd never heard of this. I had never thought about the way that I drived, never thought about the way that I walked. And I was in the public health field. The public health field is so broad, as we all know, but it really started to change the way that I looked at public health as a whole. And then I became kind of obsessed with street design, street safety. And I actually did a hypothetical street safety project on the street where my brother was hit. At this time, he hadn't passed away yet. He was still in the hospital. So I did a street project to make his street safer with a few of my friends in class. And it's kind of funny to look back at it now, because it was actually pretty good. Like now that I know about transportation safety and like the enhancements that we made to make the street better, the lighting and all of that. So that was the beginning of my introduction, I should say, into this field. And then I joined a group called Families for Safe Streets in New York. It was founded by a woman named Amy Cohen, who lost her son, Sammy, who was hit by a car. A ball had rolled out into the street, very simple. And, like a lot of the stories are, not very complicated. And she lost her son, and she founded this organization to bring families together who either they had been hit by a car themselves or they had lost family members. So I would go into the city. I live in Montclair, so it's not terrible. And I would meet with people who had similar stories to mine, and I was shocked. I didn't realize that there were so many people in New Jersey, in New York, who had lost loved ones to traffic violence. And that's when I started to connect the dots. This is not a me issue. This is a New Jersey, this is a New York issue, and this is kind of insane. And then from there, I got a graduate fellowship with an organization called Transportation Alternatives. That's where Families for Safe Streets is hosted out of. And I was lucky enough for it to be a paid fellowship because a woman named Mary Beth Kelly has scholarship money because she started it for her husband who passed away because he was hit by a car riding his bike home. So she provides fellowships for individuals. So I got to learn from the best at Transportation Alternatives. They've been around for 50 years. And that was kind of where I began my, I guess, career I would say, in transportation safety and advocacy. So that was when I was in grad school. And then I kind of went away from transportation for a bit. I think I needed time to process what had happened. And throughout that time, I always thought about it, right? Mm-hmm. Just driving around, walking. And then I went and worked in the substance abuse prevention field. And I was always going to these conferences, and they would always talk about like these big, DEA conferences. And they were always talking about impaired driving. And then I was getting pulled back in. I was like, I have to get back into this field. This is what I'm really passionate about. And when looking for jobs, I saw a posting for the Brain Injury Alliance, which I had never heard of, because there's so many nonprofits out there that are doing amazing work, as we know, and there's no way you'll ever know about all of them. And I really wish I knew about the Brain Injury Alliance when I was going through this with my brother. And I saw that there was a job posting for, a public education coordinator for transportation safety. And I thought, what a perfect combination. Mm-hmm. And that's how I ended up working here.
Oh, wow. And that's a tragic but inspiring story in regard to how your personal experience led your professional career, and you were able to use the tools that you gained from the work you did with transportation alternatives and Families for Safe Streets, and to bring that to the work you're doing today. But as for traffic safety as a public health issue, you're right. It's not something that is widely talked about when it comes to public health. We have many partners through groups like Healthier Middlesex, which is a collaboration between Robert Wood Johnson Hospital and St. Peter's University Hospital. And we've been discussing a variety of things that affect public health when it comes to communicable diseases and things like that. And us at KMM, we understand that the state of our streets and how safe they are and how they appear and the culture around how people travel really affects what choices they make, whether to choose active transportation like walking or biking. And when it comes to my personal life and my friends and me just inviting them out for bike rides, all of them express to me that they're afraid of cars and afraid of traffic. Mm-hmm. So to be able to look at the system we have and to refine and rebuild it so that there are spaces for all road users, whether they're walking, biking, driving, using transit, that we see that there is a bigger goal that can affect the communities in regard to not just safety, but the health choices they make from day to day, just to go from point A to point B. So you've been with Brain Injury Alliance for some time, and can you tell us more about the organization's specific goals and mission?
Yeah, so the main mission, I would say, is really just to improve the quality of life for anyone who's impacted by brain injury. And we provide support, advocacy, information, and we also have a huge role in brain injury prevention. So that's, my role is I work in the prevention side of things, primarily transportation safety. We were founded in 1981 by a group of concerned parents who had children who had sustained a brain injury. And now we've grown to be the primary source of information and education in the state for people with brain injury. And now between, our staff, volunteers, donors, community partners, we service about 10,000 people across the state. We have, I work in North Jersey. We have staff members in Central and South servicing people all over. And we also have a few different areas to our agency that some people might not know about. Like if you guys see me on meetings, I'm in the prevention side of things, but we also have a direct care side of our agency. I do our bike and pedestrian safety programs. And as we were talking before the call, for these programs, we use a lot of fun props and experiments with our younger kids. For the high school students, we do distracted driving and impaired driving. For our older adults, We talk about fall prevention and pedestrian safety, and we do games like Jeopardy to get these messages across. We also do workshops on domestic violence and brain injury, which before working here, I had never thought about the connection between those two. And now it's like, of course, right? Of course, there's an intersection between those two topics. We also have workshops on substance abuse and brain injury. We have a huge role in concussion in the state of New Jersey. So we do workshops on concussion in youth sports. We speak to professionals, school nurses, you name it. And then we also, again, that direct support side of our agency. So we have a helpline that operates 9 to 5. So when you call that helpline, you'll be connected with a community resource specialist. And this is a part that I wish that I knew about. So when my brother was going through this, as you can imagine, my family, we had no idea what we were doing. My brother was 25. He had insurance through his job, but didn't think he needed it. So he never signed up for it. And it was a nightmare trying to navigate Medicaid. And we were going from New Jersey to New York. And you would have thought he was in a different country, trying to get him to come to New Jersey. So the paperwork, all of that was a logistical nightmare. This is the type of stuff that you could call the Brain Injury Alliance and say, we don't know what we're doing. Help us. Again, I didn't know that we existed. So we have the helpline. We also have a program called our CARES program, which is Connections, Assistance, Resources, and Education and Support. And that's for anyone who has a diagnosed brain injury. And that will help them with rehabilitation services, emotional support, and kind of helps assist them through this process, like case management. We also have support groups for the individual, the survivor, which is great if you're someone who's living with a brain injury in the state of New Jersey, to be able to connect with someone else who has a brain injury. Well, these are virtual and in person. We have them in different counties throughout the state. And then we also have support groups for caregivers, which I think these are so important, right? If you're caring for a loved one with a brain injury, and now you're able to, connect with someone maybe in, I'm in North Jersey, now I'm connecting with a mom in South Jersey who's also caring for her son. I think that connection is so important. And then lastly, we have a dedicated side of our agency to legislative advocacy. We have a dedicated staff member to this, and we also have a group that meets monthly to discuss these issues.
Wow. And so we talked a little bit about how redesigning streets can have a great effect on protecting people. Can you talk more about the legislative side of things and how public policy can help in injury prevention and for your goals and mission of the Brain Injury Alliance?
So that side of the agency, I will admit, I don't have a huge role in that. Tom Grady is our staff member who he's been there for about 20 years. So he is the one who's down at the front lines advocating for people with brain injury. So anyone who wants to get involved, I would reach out to Tom. And again, there's a group that meets monthly to discuss that.
Okay.
For our listeners listening, I just want to let everyone know that everything that we're talking about on this podcast, we will have links, emails, and addresses at the end of the podcast, and link to the podcast, because I think it's so important that we get this information out and make it easily accessible to our listeners. I did wanted to ask Kate, you mentioned the New Jersey Pedestrian Bike Safety Coalition. That's how we all met together. Mm-hmm. Could you tell us a little bit about that? And I think I joined probably a year after you had created it, but if you could just share with our listeners what it is and how incredible it has become.
Yeah, we really wanted to create a coalition just for everyone to kind of share what they were doing around the state. I know we're all part of a few different coalitions, but we just wanted a coalition to discuss the programs that we were working on and to really develop consistent messaging. That was the key part. So it's a New Jersey Pedestrian and Bike Safety Coalition, and it's based out of the Brain Injury Alliance of New Jersey. And the mission is very simple. We're all trying to move towards zero deaths. It's very like what we're all trying to do at our individual agencies. And it's comprised of people from different nonprofit agencies, educators, there's law enforcement, there's people from injury prevention coordinators, organizations like Safe Kids, TMAs, anyone is welcome to join. We're always accepting new members and we meet quarterly. We have different subcommittees on this on this coalition for social media, a law enforcement subcommittee. But one of the biggest things that we've done with this coalition is we've created a big social media campaign. And how that works is we create all the social media kind of a few months in advance. And we wanted a consistent message to go out weekly. So the idea was if you're sitting home and you're scrolling social media, Facebook or Instagram,
As we all do,
right? Way too much. And you would see a message pop up the same time, Tuesday at noon, that's the day and time that it posts. You would see that same message from multiple organizations. And then maybe it would sink in, right? So let's say the message this Tuesday at noon is a distracted driving message. You would see multiple organizations all posting that same exact image and caption multiple times. So then maybe it would sink in. And that's what we've done. So every Tuesday, you get a reminder from me with the image and caption attached, and then multiple organizations post that same post. And it's been pretty successful. We have close to 200 people that receive these social media posts, and they post it to their different social media accounts. We post things about distracted driving, impaired driving. We post it according to the NHTSA calendar a lot of times, but we get feedback from our social media subcommittee, which I know, Cristina, you're on, but we're always looking, for new ideas. But that's part of the social media, not the social media, part of the coalition. And I'm always looking for, new ideas and fun things to do with the coalition as well.
Yeah, that's super important and highly valuable to have a single cohesive message when it comes to the safety of those who are looking at their news feeds and seeing the same message. And along with that, a year ago, we passed the New Jersey Safe Passing Law. How has the Brain Injury Alliance contributed to the passing of that law? What were you doing behind the scenes for that to happen?
So we have a website called jerseydrives.com, and that is our transportation safety website. We also have our main website, which is bianj.org, but jerseydrives.com is just dedicated to transportation safety. And when the Safe Passing Law came out, we had a huge banner on our website that would take you to information on our website discussing the law, and then rerouted you to the information on New Jersey Bike and Walk Coalition that discusses the law as well. We also, for the social media campaign for the New Jersey Pedestrian and Bike Safety Coalition, we put information about the Safe Passing Law as well. And then I'm also on some different coalitions that helped discuss the messaging for the Safe Passing Law too.
Can you tell us more about those committees or coalitions that discuss that you just said?
I would love to tell you the name of these different committees. I'm on so many of them. Yeah. But when the messaging was coming out, the social media messaging, I was on a bunch of different committees with people trying to get the messaging, the language, and all of that. So there's a lot of different reviews and editing that went on behind the scenes to make sure that even the picture of the cartoon person had a helmet on, all of that. There's a lot of behind the scenes work that went on for that.
And the Safe Passing Law, it's so easy to do, but so hard to capture in a single image. And we've struggled with this, trying to have different types of promotion on social media that people can see quickly and understand and say, okay, I know what to do. But I feel like it's it's just hard to capture in a single um, JPEG or GIF.
Mm-hmm.
So I can definitely see how it was a struggle, and it requires a lot of people to put their heads together to make it easy to understand. But the main message is to slow down and then move over and pass when
Mm-hmm.
it's safe, and to allow at least 4 feet between your vehicle and the vulnerable road user, whether it be a bicyclist or scooter or pedestrian.
Mm-hmm.
Um, so we're happy to celebrate the year anniversary for the safe passing law. And one thing I wanted to ask you is, we had mentioned your work with transportation alternatives and families for safe streets within their organization up in New York. Have you been involved with families for safe streets here in New Jersey?
I have been. So I haven't been able to attend the meetings that they have, but I'm very involved with Division Zero New Jersey Alliance, which is kind of tied to Family for Safe Streets, and the Family for Safe Streets events that we've had. So we do a World Day of Remembrance every year for traffic victims. So I always attend that. I help coordinate that event every year, and I speak at that event as well.
For our listeners, what recommendations or other avenues would you recommend to others who are looking to get involved in pedestrian or bicycle advocacy in their regions, whether they're listening here in New Jersey or across the states in another city?
I would say research what's going on in your town. Like first and foremost, whether it's a Google search, if like I live in Montclair, right? And there is a group that's in Montclair that I was part of for many years as a board member called Bike and Walk Montclair. So you can search, pedestrian safety Montclair and see if anything pops up. Facebook is a great tool for that as well. There's a lot of town Facebook groups, and just ask and see if there's any groups like that. If there's not a group, see if you want to start a group. I think social media can be very helpful in that sense. Also, town hall meetings is a great one as well. Like your elected officials are elected for a reason, so don't be afraid to utilize them for safety concerns. And if you think that there's an issue, with a crosswalk or a street, I guarantee you are not the only one who has an issue with this intersection or location. And just yesterday, I was reviewing the street in which my brother had been hit because I wanted to check in on the progress. So I hadn't looked at that street, the safety improvements in years. And I found a PowerPoint presentation that showed that there had been a street redesign in 2022 to 21st Street in Queens. Mm-hmm. And I thought, this is very exciting. Like, wow, I'm so happy they're making improvements. But I didn't see the actual intersection where my brother had been hit. I couldn't find anything that had been done to that exact intersection. At the bottom of this PowerPoint presentation that was on Google was a contact email for this guy, John O'Neill. So I thought, let me email him and just say, I introduced myself and I let him know the work that I do, and I let him know about my brother, Jimmy. And I said, has there been any improvements to 21st Street and 25th Road? This is what happened. I just want to know what had been done. I wasn't expecting anything to get back to me. I quickly got an email bounce back that John O'Neill is no longer there, and here's 2 other people's emails. So I just forwarded the email along to this person. Within 5 minutes, I had a phone call from the Deputy Borough Commissioner in Queens. And he told me what had happened on that street. And then he's like, hold on, let me double check. Let me find out for you what has been happening. And he let me know that on that street, there had been curb extensions added, leading pedestrian intervals. There had been improved signal timing, which this to me was the most exciting. So my brother, the reason why his injuries were so bad was because the person was speeding. And on that street, if you made the 1 light, you made the next 3. So everyone would speed down that street. They changed it now that you physically can't do that anymore. I've been kind of wondering for years what had happened, and all it took was for me to reach out to someone off a PowerPoint presentation. And then at the end of our phone call, I said, has the lighting been improved? Because my brother was hit at night. Mm-hmm. And he said, you know what? I'm not sure about that. Let me open up a lighting investigation for you. And he quickly, within 20 minutes, gave me a case number. And now there's a lighting inspection is called. Wow. So my point of that is you never know unless you ask. Right. And if you don't get the right person, maybe you have to email someone else. Maybe you have to find them on LinkedIn. Maybe you have to find them on Facebook or call someone. This was obviously a very good outcome. Mm-hmm. And this person, you could tell, cared about what they do for a living. But it was a great example of just kind of finding good people and asking the right questions and then getting a great response out of it.
Yeah, it's amazing. And like you said, all you have to do is ask and inquire. And it took a little persistence to have to forward the email again. But that aside, you got the answer that you were looking for, and they continued to reach out to you to see what improvements they could make by doing that light inspection. But yeah, there are people in local government and who have these positions who care. So asking can go a long way. Let's see, we have one other question here. I'll have one more to add on to that after, but sorry, it's me talking out loud. Bert, if you could work on that. So the Vision Zero Alliance, it's different from the other groups we've mentioned, like Transportation Alternatives or Families for Safe Streets or Families for Safe Streets in New Jersey. Can you tell us more about your role and involvement in the Vision Zero Alliance?
Yeah, so I was involved with the Vision Zero New Jersey Alliance kind of from its inception, which has been exciting. And I was been on the leadership committee. I know we're kind of restructuring the Vision Zero New Jersey Alliance at this moment, but we're really a group of advocates. And the whole purpose of this alliance is to support the development and implementation of Vision Zero policies and actions in order to eliminate traffic fatalities and improve mobility throughout New Jersey. There's been Vision Zero in other parts of the country for years, and we're just trying to get that here in New Jersey. We have meetings every month. They were just moved to the third Wednesday of the month at 2:00. So if you're interested in joining, you can reach out to me and I can connect you, but they're open really to anyone. We have people who are professionals. We have people who have lost loved ones. You don't have to work for any specific organization to join these meetings. They're very casual. My role, kind of similar to some of the other committees that I work on, I kind of come from the Brain Injury Alliance perspective, then I also come as a sister who lost her brother. And so I'm very passionate on some of these meetings, some of the topics that we talk about. Right now, we're working with legislative leaders on a proposed bill for a Vision Zero commission. And this commission will be comprised of different organizations. We don't know the exact number of that yet, but these people will help make decisions on different policies moving forward. So that's what we're working on right now, is this Vision Zero commission.
Wow, that's excellent. Yeah, we look forward to hearing more developments on that. And those meetings, again, you said they're for the public, for anyone who's interested in preventing road injuries and deaths. When do those meetings happen again?
So they are the third Wednesday at 2:00. They just switched, but if they happen to change, we can let everybody know, but we just moved them to the third Wednesday at 2:00.
Yeah, and you can send us the information. We'll include that in the information for our listeners. And one more thing I wanted to ask you was, with your involvement with Bike and Walk Montclair, it's a local advocacy group focused on making improvements and making biking and walking more accessible to those in the region. We have one in Middlesex County who is Bike and Walk Metuchen, and also a similar advocacy group, similar goals. Now, we don't have many of those groups in New Jersey. There are a few, maybe more in Hudson County. But what advice would you have for people who are interested in starting groups like that in their localities?
finding like-minded people, I would say, is probably the first thing to do. I know in Montclair, we have Bike and Walk Montclair, but then there's also other people who are also forming groups to kind of get a stronger group going. And I see that happening on Facebook, just with people who are concerned about the streets, because we have Bike and Walk Montclair and they do amazing work, but it's also hard to get work done when your elected officials are not working with you. So there's a group of people in Montclair who are also kind of trying to help Bike and Walk Montclair. So I think, again, social media, like you could, on your town Facebook group, saying, I'm looking to form this group, a pedestrian safety group, who's with me? Like that's probably where I would start, because that's where you're going to be able to collect people and then see who you kind of have on your side if you're not already in the transportation field and you don't know kind of where to start.
Yeah, that's huge. Using social media to gather groups of people who, with those interests, can go a long way. Now, what kind of fun initiatives did Bike and Walk Montclair do, or what kind of fun initiatives can bike or pedestrian safety or advocacy group do to gather their folks?
So one big thing that they do is the Learn to Ride classes, and that's Paul Mikowitz from New Jersey Bike and Walk Coalition. So he is amazing, and he teaches so many people of all ages how to ride their bike. This is from little kids to adults. I know it's a very successful program that they do. They do a lot of volunteer events, and they also do, we haven't done it in a little bit, but the Tour de Montclair. It's a huge town-wide bike ride. I know we had some issues with the pandemic and permits and all of that, but that is a huge event. You get all these people throughout town, people who typically wouldn't ride their bike or wouldn't ride their bike, much further past their house, and they're touring around the whole town, different routes. It was a very exciting event. So if you're able to do that in your town, organize a bike ride. And they also would do different events like holiday bike rides, and people would put lights around their bikes and play music and slow rides. So you don't have to be a serious bike rider to go on these just casual bike rides and meet up with people and just really encourage bike riding. I think sometimes bike riding, as you mentioned earlier, it can be scary to people, and especially with our roads that don't encourage safe riding. But studies have shown the more people who ride bikes, the safer it is. We need people out there riding bikes. So, get a group of friends, go out there and ride, and kind of the more you ride, the safer you will feel riding. That's what I've found, even for myself personally.
Right. Kate, I have to just say your path, your story, it's so inspiring. And we really want to thank you for sharing Jimmy's story. I was taken aback, and I know that it's not easy to share that over and over again, but I appreciate you taking the time to do so. You're truly honoring his memory, and I can't wait to hear about the lighting. You have to let us know if the lighting has been improved. So I guess before we wrap up, I'd just like to let our listeners know again that all the programs that we mentioned will be linked in the podcast. We always thank you for listening. And just one or two final thoughts, Chris, Kate, before we close it up.
Yeah, well, I'll start. So Kate and I, we've partnered on a couple of things. I think I've seen you at one of our bike rodeos, and we've had Deb and some of the other staff from the New Jersey Brain Injury Alliance join us. And a lot of that was around the helmet messaging and how helmets can go a long way. But we know, having worked in transportation, that helmets only do so much. We understand, we think helmets are important, but at the same time, what we want to see are spaces built out for people to walk, to bike, to ride their e-bikes or e-scooters or whatever they ride in the streets, and having designated spaces for them can do the most to save lives and to prevent injury. But I think that's one important thing that we as safety professionals are saying more than just put on a bike helmet, you'll be safe, because that's just not the whole truth.
I agree. I mean, I would love everyone in the world to wear a helmet. I think everyone should be wearing helmets, right? I work for the Brain Injury Alliance, but I also think our streets need to be safer, because at the end of the day, people are going to make mistakes, right? We can't find every human on the planet and give them a safety presentation. And even if we did, we would have to keep doing that for the message to really sink in. I talk to high school students and I tell them that I make mistakes all the time and I do this for a living, right? So you have to decide what type of driver you want to be, right? Try to limit the mistakes from happening, right? And that's why I always put my phone up in the GPS clip. Like that helps me from not grabbing my phone. I tell the kid, I'm like, I still want to use my phone when I drive. I love my phone. I have to consciously not text and drive. It's hard. Like I do this for a living and I still want to use my phone. So you guys have to really try hard. If I want to, and I do this, like I try to be really honest with them. So knowing that even if it's hard for me not to, do bad things when I drive, how hard is it for the rest of the world? Knowing this, we have to build roads that allow for mistakes to happen. And right now, the roads are not set up that way at all. Right. And that's what I'm passionate about. Like, let's find the streets that are unsafe and take it one road at a time.
That's right. There's so many solutions that we can apply to them. It's time we start. Thank you, Kate. Thank you, Chris. And thank you to our listeners. We hope you join us on our next episode and ride safe, be safe, drive safe. Thanks.
Thank you, everyone.
Thank you.
Funded by the North Jersey Transportation Planning Authority and the Federal Highway Administration.